morning. This is Awani Tonight, and I'm Soraya Mia. Healthcare systems stretched. Avoid riot gatherings, warns respiratory specialists. And on International Nurses Day, we celebrate their contribution to society. That's coming up. Malaysia today reported 4,765 new COVID-19 cases, the highest number recorded in over 3 months. Meanwhile, 39 deaths have been reported today, marking a new all-time high. Selangor reported the highest number of new infections with 2,082 cases. The Health Ministry warned that daily cases could hit 5,000 in mid-May. With a recent spike in COVID-19 cases, Malaysia is now a far-off worse state this year than it was the same time last year. Respiratory specialist at Pantai Hospital, Dr. Hilmi Hajamaidin, said at this point, the country's healthcare system would not be able to handle a further surge in cases.
It's not just about the numbers you see on the television every day. I think more importantly, if you look closer, you'll see that we have, I think, about 500 ICU cases at the moment. We've got a few hundred of patients on ventilators. And our DG of Health, Tan Sri Noor Hisham, recently mentioned how most hospitals are running out of ICU beds. And I can attest to that even in the private sector, that's happening. So these are all worrying signs that the healthcare system is under stress, that if we have a further surge, if we have an increase, a potentially exponential increase of cases after Raya because of movement, then we will struggle. And the consequence of that is that people don't get the right care at the right time, which may lead to poorer outcomes and even death. So that's the context in which we are celebrating Raya this year. So it's a bit of a downer, it is, and I suppose I'm being a Grinch here, but what we really need to bear in mind is that the risk far outweighs any benefits of moving around and seeing people.
Dr. Hilmi reminded Muslims celebrating Hari Raya that the zakat fitrah, or charity taken before the ending of Ramadan, is the only religious obligation, while everything else is regarded sunnah. Malaysia should take the lead and negotiate for more COVID-19 vaccines from pharmaceutical companies amidst a shortage of supplies. President of Malaysian Medical Association, Professor Dato' Dr. Subramaniam Muniandi, says this is crucial as the earlier a country progresses in its COVID-19 vaccination program, the sooner the country can recover.
Now, it is WHO as well the World Medical Association has said some of the richer, more prosperous countries might be hoarding some of this vaccine, and they should be able to, there must be equity in the distribution of the vaccine. The producers as well as the other countries should share, and our country should negotiate whenever they can, whenever they should negotiate for more vaccine supply.
The United States is supporting a push proposed by India and South Africa for countries to temporarily waive patent protections for COVID-19 vaccines so that more doses can be quickly manufactured and distributed around the globe. Dr. Subramaniam welcomes the move but says it may be more symbolic than substantive.
When the need is great, it will be unlikely they will want to waiver the patent because this is business for them. Nobody gives away the patent unless they find their production is going down and they can allow others to use it. It will be, of course, a great idea if they would say, take away the patent and let others produce the vaccine. But I think at this moment in demand, I think it's going to be impractical.
The U.S. Department of Justice has returned 1.9 billion ringgit of funds recovered from assets related to 1MDB to the Malaysian government. The funds were directly channeled to Malaysia's Asset Recovery Trust account. So far, the trust account has received 16.05 billion ringgit of seized and repatriated 1MDB funds. Minister of Finance Datuk Seri Tengku Zafrul Abdul Aziz said the recovered funds would be used to repay liabilities of 1MDB and its former unit SRC International. He said the current balance is sufficient to service 1MDB's debt obligations for 2021 and 2022 only. The Malaysian government has so far repaid 12.4 billion ringgit of 1MDB's debt and 3.1 billion ringgit of SRC's debt. 1MDB still has 39.8 billion ringgit in outstanding debt, while the unit SRC has 2.57 billion ringgit of remaining debt. International Nurses Day, celebrated every year on May 12 globally. A day to express gratitude to the hard-working nursing staff who show nothing but selflessness and compassion in their everyday duties, besides being at the forefront of fighting the COVID-19 pandemic. To commemorate this day, we speak to nurse Parimala Devi Munusamy from Hospital Chancellor Tuanku Muhriz UKM to better understand the role of nurses and their contribution to the society.
Caring is a pillar for the nursing, and we can define that as empathy, compassion, human dignity in deliver nursing care. And communication also is vital. If we don't have a good communication between nurses, patients, or other healthcare workers, we are unable to carry out quality treatment and care for the patient. And other than that, nursing profession is a knowledgeable, is a skillful, and nurses will have competent enough to face an issues like pandemic. So they are, if they have a knowledge, they have a skill, they can practice good SOP so that we can control the infection. We can control the infection even in the healthcare setting itself.
While nurses have served the public far beyond the pandemic, Nurse Mala said that what nurses actually want the most is to feel valued and appreciated for their services.
They are undervalued for what they serve, and they think that nursing job is not glamorous like other professions. They think that is like a dirty job because we do serve bed pain for the patient, for their bowel training and all that. So public perceptions or misconception is they think nursing job as a dirty job. Actually, you've asked me personally, the nurses need a respect the way they are and thankful for what they have done. That means the sincere thanks for what we have done. So don't undervalue us. During this pandemic season, actually, we are coming forward to serve the nation. Nurses, actually, they are like heroes, superheroes. So I would like to wish Happy Nurses Day to all nurses in the world.
We'll take a short break. Stay with us.
Dan maju. Induknya adalah Melayu Islam.
Orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita, sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita
Welcome back. Picking up where we left on the topic of urban poor after the release of the final part of Families on the Edge report. More than a year into the pandemic, how can we better assist this group on their path to recovery? What targeted solutions are needed? We speak to Stephen Barrett from UNICEF Malaysia.
The financial security, the economic security for low-income families is the foundation for everything else. It's not sufficient. It's not sufficient, but it's a necessary condition for a whole range of other issues. So, we have recommended the extension of, at the very least, the social welfare system payments programs to all households living below the poverty line, and that is the foundation upon which other things can be built. Once you provide that economic security to families. Parents are saying they're really struggling to supervise their children. They're really struggling to motivate their children. Children who themselves are struggling with the mental health effects of what's been going on for the past year. I think if we now schools have been closed again, so many of the low-income families, their children should have been receiving free school meals during this time. So I think really we need to be ensuring that that support, which would have been extended if they were in the classroom, is extended to those families when they are at home. Healthy meals for low-income families, or the means by which families can provide healthy meals for their children.
Stephen emphasised on the support needed for parents with children involved in home-based learning and for the government to consolidate their efforts to better assist low-income urban families.
We need to ensure teachers are equipped with the ability to recognise mental health problems and bring in other professionals where necessary, and provide that sort of mental health and psychological first aid to children that they in their classrooms, or virtual classrooms in this case. Beyond that, I think looking forward for families with their recovery, the government already does provide a lot of support to low-income families. That's very much recognised, but there's a lot of fragmentation, and I think this is an opportunity whereby if we consolidate some of the existing efforts, invest in a smaller number of high-quality programs that have real reach and real impact, then that's how we can get better bang for our buck as we work our way out of this crisis.
On the international front, at least 35 were killed in Gaza and 5 in Israel today as violence escalated in the most intensive airstrikes for years. United Nations Middle East Peace Envoy urged leaders on all sides to take immediate action or bear a full-scale war. Israel carried out hundreds of airstrikes in Gaza this morning as Hamas fired multiple rockets at Tel Aviv and Beersheba in the worst violence since the 2014 Gaza war. One multi-story residential building in Gaza collapsed and another heavily damaged after being repeatedly hit by Israeli airstrikes. Meanwhile, Israel declared state of emergency in the city of Lod after clashes between Israeli forces and Palestinians intensified. More than 1,000 rockets have been fired towards Israel since Monday as Israel's military targets Gaza in response to the attacks. Weeks of tensions boiled over when Israeli riot police clashed with Palestinians at Jerusalem's Al-Aqsa Mosque last Friday. Meanwhile, in London, scuffles broke out between police and pro-Palestinian protesters at a demonstration calling for an end to Israel's military action in Gaza. The protest near Downing Street was organized by the Stop the War Coalition, the Palestine Solidarity Campaign, and a number of other pro-Palestinian groups. Large numbers of police intervened to prevent Palestinian supporters from reaching a small group of pro-Israeli counter-protesters. The pro-Israeli demonstrators were eventually escorted away by police for their own safety. A record number of people were killed by COVID-19 in India in the past 24 hours, pushing its overall death toll to over 250,000. Medical experts say it was too early to say if infections had reached a peak. 4,205 deaths from coronavirus were reported today, while daily coronavirus cases rose by over 348,000, with India's overall number of cases surging past 23 million. India, with a population of 1.4 billion people, currently accounts for more than 1 in 3 of the reported deaths from COVID-19 around the world. Meanwhile, the World Health Organization said that the Indian COVID-19 variant, or B1617, has been detected in more than 44 countries. Earlier this week, the WHO declared the Indian variant as being a global concern, similar to variants detected in Britain, Brazil, and South Africa. As we celebrate a second Hari Raya under the shadow of a pandemic, how do we keep our festive traditions going? Tonight on Consider This, we speak to our panelists about their Eidul Fitri stories. Thank you for watching Awani Tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Saraya Mia, on behalf of the Awani Tonight team, wishing all of you Selamat Hari Raya, Maaf Zahir dan Batin.